The ID slip is most suitable for patients with heavy incontinence and comes in different sizes and levels of absorption. This style of product is usually recommended for patients that are confined to their bed or with reduced mobility. The product should be properly positioned to ensure comfort and safety for the user. Start by unfolding the product. It is important not to shake the product when you open it, because the movement can break down the integrity of the absorbent pearls and then render the product ineffective. In addition, if you need to apply cream to the patient, it is also important not to wipe your hands inside the pad to remove excess cream, because this could adversely affect the absorption of liquids. Next, shape the full length of the product into a channel and activate the anti-leak side cuffs. This is important to limit the risk of leakage when in use. Gently roll the patient onto their side and secure this position by raising the upper leg if possible. Slide the protection between the patient's legs from front to back, keeping it folded lengthwise. Hold the end of the product with one hand and slide the other hand between the patient's thighs. Take hold of the product and pull it gently. Adjust the rear and front distribution area to cover the urination zone. Do not pull the protection backwards, as this gesture can shift the distribution area out of place. Also, try to create a gap between the inner thigh of each leg and gently lift the protection up to cover the urination area. Fan and unfold the protection to lay it flat across the patient's buttocks. Make sure that elastics are positioned inside the gluteal folds. The skin from the inner thigh is outside the protection in order to correctly use the anti-leak barriers and avoid risk of leakage. It is then necessary to ensure the product is centered in line with the spine, using the wetness indicator lines as a guide. Slide the side panel of the product between the mattress and the patient, making sure not to move the rest of the product out of position. Roll the patient back on their back and make sure the side panels on each side are accessible. Adjust the front so that the elastics are properly inserted between the gluteal folds without being stretched. If elastic is too stretched, it could cause discomfort against the delicate skin and stop the anti-leak barriers from working. To facilitate this step, separate the legs slightly so the skin on the inner thighs is outside of the product, and position the protection without pulling it. Position the lower fasteners in a slight upward angle, clear of the upper thigh, ensuring a secure fit around the legs. Then secure the resealable top fasteners by tilting them downwards to ensure a secure fit around the waist. This step also helps protection to adapt with the patient's movements, and the fasteners can be repositioned several times. A few tips for a larger patient. To facilitate the rear and front distribution of the protection, follow the line from the gluteal fold to the edge of the side panel, as if to close it. The slide panels should cover the area without being too stretched. To position the protection for effective use, part the skin from the inner thighs. This will create a space. Now roll the protection up to cover the urination area. To search for the side panel of the slip product, lightly roll the patient sideways to gain access to them and pull softly on the panel. Then gently revert the patient onto their back. If the upper fasteners are on the abdomen, they will cause the patient discomfort if they decide to sit up. This is because the abdomen, in a seating position, does not have the same volume as when lying or standing. However, if the fasteners are closed under the abdomen, the protection may down backwards. And cause leaks. To alleviate this, the upper fasteners must be fixed by tilting them downwards, thus under the abdomen, which will place protection in the patient's back and ensure it remains in position. Tips for a restricted fetal position. If a patient is restricted to a fetal position, the fasteners are in permanent tension and they are often the cause of pain or injury. It is important to use the patient's bone as markers to position them, mainly the pelvic bone. This way, the fasteners will better adapt to the patient's positioning and will not cause discomfort or injury.